Hey guys, what's up? It's Trent, Revive Physiotherapy, and we're back with part 2 of the running related injuries for the lower leg. Last week we talked about injuries to the front part of the lower leg, and this week we'll talk about why you might be feeling some discomfort on the back or inside part of your lower leg. So as you can see here, posterior medial overload, basically it's because you're spending too much time on the ground. We see those people all the time where they're just kind of plopping along, spending so much time on the ground. Now what that does is it basically overloads your calf, which is the back part of your leg. So every time you're on the ground, if you spend so much time on the ground, you're loading your calf, loading. So basically over time, it gets overworked. And so one of the cues that I like to use for runners that come in presenting with this type of discomfort is to try to have a more stiff landing. So less knee flexion as you do that. Obviously it's hard to simulate doing slow motion, but think about landing a little more stiff. And then the second one we discussed last week was increasing that step rate, which will subsequently reduce your stride length. And then to finish, a quick review, the 3 universal recommendations that I give to a lot of runners. The first one is to increase that step length like I described. The second one is strength. Like I said, you can't go wrong getting strong to help your tissues become more resilient or resistant to injury. And the third one is to monitor your load. Don't do too quick or too much too soon. And then a quick reminder, the shoes, something's comfortable. Don't worry about getting assessed for if you're pronate too much. That stuff's just really BS. Find something that's comfortable for you. And don't try to self-diagnose if it's something serious. There could be some red flags, whether it's compartment syndrome, stress fractures. So don't Google your symptoms. Seek out a healthcare provider if you suspect something else going on. So that's it for the running lower leg injury segment. I hope you guys enjoyed it.